Hello and welcome to episode 1 of Betty's Gym. So here we go. Today we're going to focus on scapular cars and thoracic spine. So that's right here. So to warm up, we always want to warm up kind of the joints above and a little bit below so that everything is moving okay. So we're going to start with neck CARS. CARS is an acronym that stands for Concentrated Articular Rotations. So this is straight out of FRC. It is, the goal is to move each joint as individually as possible. And for us who are aging or have joint issues like arthritis, autoimmune, you name it, it's really important to keep those joints moving. They are called synovial joints because they have synovial fluid in them. And that movement just stimulates that fluid. So for older people, people that have joint issues, arthritis, autoimmune, all that stuff, that synovial fluid tends to not flow as freely, or we don't produce it as much. So it's important that we are moving those joints as much as they will move and preserve that motion. Now, when we do CARS, we want to move the joint as much as it will move safely. Okay, so safely means we're not feeling pinches or pain. Now, because we are older and we have joint issues, we may feel an uncomfortable stretch. We may feel something in the joint that isn't pleasant all the time. But as long as it's not a closing angle pinch, and what I mean by that is we put our head down and there's nothing here as a pinch, we're okay. If we do feel a pinch or pain, we want to move around that. So if all the way down is too far, we go most of the way down until we start to feel that pain start to give us that notification. We go as far down as we can to where it just is almost ready to start, and then we avoid the rest of that motion, okay? So if you're feeling an ouch, pull out of that position and move around it. And for those of us who, again, are older, have joint issues, have injuries, have autoimmune issues, we need to do a diagnostic every day because it's different every day. And it's different from side to side. This shoulder isn't going to do what this shoulder does. And what it did yesterday isn't a guarantee for what it's going to do today. So we use CARS as a diagnostic tool as well. And then toward the end, I'll show you how to use CARS as exercise as well. So there's 3 things we do with CARS. The first and probably the most important for us is to get that synovial fluid going, but then also to diagnose. So that's what we're doing here. Neck CAR, the complete neck CAR is a rotation, but we're going to start with just flexion and extension. So we're going to pull our chin back to get this vertebrae, and then slowly down. Then we're going to unwind, keeping our chin tucked. You'll see my nice double chin, double neck. Pull all the way up into extension. And yes, we're going to go slow because we don't know what this joint is capable of yet today. So we're going to do 2 or 3 of these. And you'll notice when I get to the bottom, my chin does untuck a little. And when I get to the top, it untucks and extends. One more. Okay. Our neck does other things as well. So we're going to tilt our ear to our shoulder as far as it goes today. Take a breath. Go back up to neutral. Tilt our other ear to our other shoulder. And look at that. My neck doesn't like that much today. Let's do it again. Take that deep breath in the bottom positions. That breath kind of signals to your nervous system that it's safe and can relax into that position, even though it may not feel comfortable. All right, and now we're going to turn our head like we are checking into the blind spot when we're driving. We're going to turn over this shoulder as far as it'll go today. And we'll look back straight. We'll turn over the other shoulder. We'll go back straight. And while we're doing these, you'll notice that I am sitting for these. You can do them sitting, you can do them standing, you can do them in any position where your spine is straight. For a warm-up, I prefer sitting or standing, but as we do exercise, we will be using other positions because gravity responds to the position differently. Okay, we're going to do the full neck car now. So the full neck car starts by flexing, turning to the shoulder, bending the ear, extension. You're going to kind of unfurl as you get to the back in neutral. Then we're going to look over the other shoulder. We're going to bring our ear to our shoulder. And we're going to rainbow across to neutral in flexion. All right, let's go the other direction. Turn your head, side bend, rainbow across, look to the other side, bring your ear down, and down to the middle. Okay, let's do two more. So down, to the side, side bend, rainbow across, look over the other shoulder, bring your ear down, let's go back the other direction, side bend, rainbow across, look over the other shoulder, and down. And if anything was pinchy or painful, you'll just want to cut that out of the rotation. So if your neck doesn't go this far today, it just goes here, that's where it goes, and maybe your neck car looks more like that instead of the whole thing. And that's fine, that's just where you are today. And now we know that it's important for training, because if you're going to do overhead stuff and your neck doesn't move the way it should, or your scaps when we do them doesn't move the way it should, then you shouldn't be lifting things overhead today. Tomorrow is a different day. Okay, let's look at our scapulars. So our scapula is this bone on our shoulder here, and it goes up, forward, back, around, and down. It goes in a big old circle. And when we're doing the big old circle, our hand usually just goes up and down. So we're going to do that slowly. Pick a shoulder, and we'll do it together. So let's bring our shoulder forward. And you'll notice the rest of me is not moving. This is just this scapula. So I'm not punching my whole body. And when we go back, I'm not going to be extending my spine. I'm just going to move the shoulder. So let's move the shoulder forward, up toward our ear, back, and down. Let's keep going in that direction. And it's important to slowly and carefully explore how far we can go in each of those directions safely without pinch or pain. Because if we want to load it today, which we do, it's not going to work, and we will be prone to injury if we load it in a position that it's not prepared to work on today. All right, let's go backwards. So back, up, forward, and down. We're going to go 3 or 4, maybe 5 circles in this direction. We'll see. You want to go as smooth as possible. But sometimes I notice that mine is jerky because my nervous system is jerky some days. And that's just something to notice. And that's one thing that we haven't talked about is training reinforces the connection between your brain and whatever tissue you are training. So even scap cars or cars in general reinforces this connection of your brain going, oh, I have a body and this is what it means to move it. All right, let's do the other side. Same thing. Forward, up, back, and down. This is a new shoulder. It may do something similar, but we never want to assume because it is a different shoulder and it is a different day, and we just need to check in and see what it's capable of today. All right, let's switch directions. So back, up, forward, and down. Back, up, forward, and down. Let's just do a couple more. And remember, we want to move this joint and only this joint. We don't want our spine involved. We don't want anything else involved. Okay, go ahead and finish the circle that you're on. And we're going to do some shoulder cars. So the full shoulder car, your shoulder does a lot of stuff. Lots of stuff. It rotates in and out. It goes up and down, and then it rotates while it goes up and down. So we're going to do a shoulder car, and I'm going to show you, hopefully from this seated position, and you can see everything. So check out my super white skin in the glare. Oh yes, glare, glare, glare. So you're going to start with your palm out and down. And while my palm is out and down, I'm going to be trying to rotate as far out as I can. But I'm only going to be able to rotate so much. So you can see kind of the glare on my elbow pit here. This is, you can kind of tell that it's not so much about the hand, it's about this area rotating out. But the hand is a good clue because, okay, the hand can't rotate all the way out without this. But you don't want to just do the hand. It's not just the hand, it's the whole thing. You want the whole thing to rotate out as far as you can. All right, we're going to sweep the arm across the body while our hand is rotated out. And we're going to go up as far as we can. And as we go up, our hand is going to lose, or better yet, our arm is going to lose some of the rotation. So I'm doing pretty well on my overhead reach today, but there's some days where you might have to reach out here because that's as far up as it goes. It's not going to go up by your ear. So I've reached out and up. Now at the top, our arm is going to start rotating in. And you can't see my hand because it's out of the frame, but now my hand went from here to there. So my thumb is starting to spiral around and reach back. And I'm reaching back behind me, reaching back, and then turning, 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 so that my hand, when I end, is like that. So let's try this one more time. Reach across, palm up, reach up, turn, thumb is reaching back, reaching back, reaching back, reaching back. And now when I end, it's close to this. Okay, everybody's range of motion is different, and every day is different, and every joint is different. So your car may look more like this today, and that's great. That's fine. The other thing is we don't want to shrug our shoulder when we're doing the car. We want to keep it low. So the only thing that's moving is the rotation in this shoulder capsule. Okay, then we reverse, unwind, unwind, up at the top, palm is up now, and I'm going down. All right, let's try it one more time, and then we'll move to the other shoulder. So palm is out, sweeping across the body a little bit, reaching up. Our hand is now turning. Thumb is leading now in the back. It's reaching, 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 reaching. Down at the bottom, we reverse. We're unwinding. Up at the top, palm is up now. Going across the body and down. Okay, let's do the other arm. And it's not uncommon when you're switching sides to go, oh, I kind of know how to do this now, and get over here and go, what are we doing? So amnesia is a thing. So we're going to start palm up. We're reaching out as far as we can go, but our elbow is straight. And what we're really focusing on is here. Our hand is along for the ride, but the hand is a good indicator of what our shoulder is doing, or it can be. Okay, palm up, sweep across the body, reach up. Now we're going to unwind, and our thumb is going to turn, turn, turn. Oh, look at that. Different range of motion in this arm today. I'm reaching back with the thumb, and then I'm ending, and my palm is out, and my thumb is back. We're going to reach back with that thumb, unwind, unwind, unwind. Ooh, pinchy. Move out of that. I'm at the top, My palms should be facing up as I start moving down and across the body. And we end with palm out. One more, palm up. The top, we unwind, reach, reach, reach. And I'm cutting around some painful places in that shoulder today. Palm back, thumb back, palm out, thumb back, and we reverse. Unwind, palm up, and down. Okay, so we have warmed up our neck, our scaps, and our shoulders. And we should know kind of what they're capable of today and what we can do with them. So for the workout today, we're going to need a tennis ball for the very end. We need the lightest long band, and lightest I mean the least amount of material. And you need a yoga block. The yoga block is going to be a substitute for the band and maybe a substitute for the wall. We'll see. But you'll need those three things today as we do our exercises. So we're focusing on scaps and thoracic spine. We've warmed up our scaps and our shoulders. And so we're going to focus on moving those shoulder blades back and out. So kind of a pull and a push. Let me turn around. So it'll be a pull and a push because your muscles only do one thing. The muscle group either pulls or it pushes, and you have two muscle groups. One of them does the pulling, one does the pushing. So you need to exercise both, okay? So for you, especially that pull, you're going to want to pretend like you're pinching your shoulder blades together, okay? And you may not be able to get very far, but that's the whole point, is we're going to try, we're going to activate those muscles, and as we work them over time, you're going to be able to get more movement and then more force production in that, okay? So we're going to practice with scap push-ups, scapular push-ups, and there is a progression. So a good place to start is against the wall so that you don't have to support much of your body weight on your wrists and hands, okay? So I'm going to move our implements. All right, so right now I'm fairly neutral, but I can pull my scaps all the way back, and then I can push them all the way forward, and that is a scap push-up. Let's do it one more time. So push out, and then pull back, and I'm going to pretend like I'm trying to squeeze a grape between my two shoulder blades. Out and back. Okay, that is the least stressful position, okay? If this is feeling good and easy, you get your countertop and you lean lower, out and back. And I demonstrated that wrong. We're not bending the elbows. It's not a push-up like that. We're just pulling scaps back and pushing them forward, okay? And this isn't ideal because my bench is in the way, okay? Countertop, back, forward, back, forward. If that is too easy, you can get a chair or the edge of your couch. Back, forward, back, forward. And if you are really, really good at this, you can do it against the ground, like a regular push-up. But again, we're not pushing, we're not using our elbows, we're just going back and forward. So we want a position, one of the progressions, that isn't too hard, where we can get about 10 reps in. And then take a break and then do it again, okay? So we want, if it's the wall, perfect. I would rather err on too easy than too hard. If it's against the countertop, wonderful. Couch, floor, whatever. But Mom, I would say start against the wall, okay? The other exercise that we're gonna do is banded pull apart, okay? Now, I would do one band and leave this part slack. And again, what we're gonna do is we're going to pull apart and squeeze those scaps together so that we're gonna be pulling like this, okay? But the motion is coming from that little spot in my back. So we're not going backward and forward like the push-up. We're going out to the side, okay? Now, if one strand on the band is too much, that's okay. You can mimic the same thing. Let me get the other block. With yoga blocks, but you have to squeeze your hands onto the blocks and squeeze everything on your arms like you're pushing against something really strong, okay? But that way you can do the same motion with the same muscle intensity, but without the band. You want to do 10 of those, okay? So the workout, and you're going to want to pause the video, is 10 scap push-ups, 10 pull-aparts, 10 scap push-ups, 10 pull-aparts, 10 scap push-ups, 10 pull-aparts, okay? So 3 sets of 10 each, and you alternate, okay? I'm not going to do the workout with you. So pause the video and I will see you in just a second. We'll do the wrap up and I'll show you what you're going to do for recovery tomorrow with the tennis ball. Have fun. First of all, how was that? Don't worry, you will tell me all about it, I'm sure. Okay, before we leave today, we want to just put everything all together, make sure our nervous system knows what's going on, and that we are winding down and wrapping up. So we're gonna wrap up with a shoulder car, but we're gonna use the yoga block as, again, a radiation tool. We're gonna squeeze the yoga block as we do our car. The other thing is you can do this in the doorway to get another sort of feeling, and I'll show you how to do that against the squat rack here. And then I'm going to show you how to use the tennis ball to help your shoulders tomorrow when they hurt. So here we go. In your doorway, so here's my doorway. I will just get inside the doorway. Inside the doorway. I will use my block. And so I'll be turning the block as it goes. And just like we did in the warm-up, we're going to go up as far as we can. We're going to spin the yoga block because it's in our hand. We'll reach back and down. Reverse. and down. One more. Okay. And don't forget the other side. I need to go to the other side of my pole because my other thing doesn't have access. So palm up, block up, spin, back and down, up, spin, back and down. And we're using the doorway to block anything else that might be moving at the same time. There we go. All right. Tomorrow you're going to feel fantastic. Just kidding. No. So there's a couple of things you can do with the ball, and I recommend the tennis ball only because it's squishy and it is less likely to bruise. Often we use a lacrosse ball, but it's very hard and it's very good for tacking, which means it grabs the skin and you can pull, which is another technique, but I'll teach that to you some other day. So we're going to use the ball against a wall, and you can put the ball right on your shoulder and lean against the wall and move it around slowly, and it will ease some of that muscle tightness and tenseness. You can also put the ball against this neck muscle, your trapezius, and do part of your shoulder car. And if you twist the ball a little bit, that also helps. But I think most of your work is going to be on your back. So up against a wall, just put it against your shoulder and then push against the wall and rub back and forth. Okay. That is episode 1. I hope you got a good workout. Go for a walk, stay hydrated, and I will see you on Wednesday for episode 2. Have a great day.